Dr. Budoff, what causes a painful snapping of the elbow?
If you have snapping of the elbow that is painful, that can be due to a loose body in the elbow. They used to call it joint mice, or it can be a plica. When we were in utero, we had these separations of our joints and they go away, or they can remain and they're thin and they don't bother you, and sometimes you just get a snapping of a joint and it doesn't hurt and it's no big deal. If you inflame that, it gets thick and inflamed and painful, you can get a painful snapping of your elbow, and we call that a plica.
How is a diagnosis of plica made?
Well, physical examination is really good. Plica usually, and it varies, but usually it's worse with the elbow bent and the forearm pronated or the palm facing away from you, then you extend it. It can also be to loose bodies, which can be caused by arthritis or trauma. Also something called osteochondritis dissecans, where some of the bones in the elbow just die and they give off loose bodies. So you take x-rays. MRI is good because it'll tell you if you have a loose body. It's not very good for plica. A good elbow surgeon or upper extremity surgeon can usually diagnose this, and then you can do an injection into the elbow. It's sort of like going to the dentist. If your mouth hurts, if he numbs the tooth and the pain goes away, that's the tooth, confirms the diagnosis. He injects inside your elbow, pain goes away, then the problem is coming from inside the elbow. Arthroscopy is usually used to confirm that. The steroid from the injection is also a huge anti-inflammatory, and it can also, if it's not too bad, can treat it by reducing the inflammation, hopefully returning it to something resembling its normal size.
What happens if I don't treat a plica?
If you don't treat it, you got what you got. You can live with it. Try to avoid the activities that lead to the painful snapping, or you can have it addressed surgically.
How is a plica treated?
I prefer to go in arthroscopically through 2 or 3 little portals or little nicks in the skin. We scope the elbow and then you just shave down the plica. My website, www.rearmyourselftexas.com, has a video of that, also more information. But you just take it out arthroscopically. It's outpatient surgery. It's minimally invasive. You're in a soft wrap for a couple of days. No real limits to the activity, but I would take it easy for a while until you get your motion back and you're feeling better. But they do really well.
Thank you for your time today, Dr. Budoff.
Thank you.